Welcome to Ghosted and Roasted, the podcast about all things dating with a comedic twist. I'm your host, Blair Bishop, and today we have Natalie Bennet. Will you tell us a little bit about yourself, about your career and everything?
Yes, so I am a dual certified nurse practitioner and certified nurse midwife. So that means I provide really any sort of medical care that is related to being female. That can be birth control, pap smears, STIs, period problems, and then also anything pregnancy related, so prenatal care, delivering babies, postpartum care, and then later in life, menopause.
That's a lot of stuff.
It's a lot of stuff, and I do have to say I actually love all of it. So
good. Mm-hmm. Do you have a favorite aspect of your job?
You know, getting to be there when babies are born is pretty special, and it's obviously kind of a demanding side because that happens, 24/7, 365. But overall, probably my favorite part about the job would be the relationships I have with my patients. I've been in this role for 8 years now, so I have seen people through different life stages, maybe multiple pregnancies, all of their kind of different needs. And sometimes a visit might be more personal, social than it is medical, and that's actually really great.
Interesting. So obviously you have to comply with HIPAA, but anything you can tell us about that?
I might start out with a patient when they are in their teens or 20s, maybe when they're dating, and see them through birth control, STI screening. Maybe then they do meet someone, possibly get married, have babies. And so then you get to be with them through that next stage too.
So, okay, backing up for a second, STI screening. Essentially, I'm curious, I don't know if there are statistics out there or if it's just like what your practice sees or whatever. How often do people usually get screened versus how often should they be getting screened?
Yeah, so overall, more people probably should be getting screened than they are. There is different guidelines kind of based on your sexual behavior and risk on you as a person, like how often you should be coming in. But the kind of biggest thing that we will see over and over again in our practice is a lot of people don't have symptoms with STIs. So they assume things are fine, and so they don't get screened, or maybe they're nervous or hesitant or embarrassed to ask for or seek screening.
Yeah.
And then with me taking care of women are more likely to get screened than men. A lot of times we'll hear that that's an issue then on the other side with partners.
Okay, so really fast, in case you don't know, STI means sexually transmitted infection, right? And formerly known as STD, which was sexually transmitted disease, same thing, right?
Yes.
Yeah, okay.
Yeah, and you'll still hear both. I probably even still say STD sometimes.
Me too.
Just because that's how I learned it initially. But yes, STI is the current up-to-date term.
Perfect. Okay, so my rule of thumb with dating is between, after anyone I've been with, I get tested just to be safe. And the struggle I've been dealing with is when I talk to guys about being intimate, they won't give me their test results. They won't get tested per se. So I'm like, okay, peace out, bro. But, sometimes heat of the moment things happen or whatever. But do you have any thoughts on all that?
Yeah, so I love this practice for you. I mean, I think that you're probably doing exactly what you should be. It's important to protect our bodies. And so generally I would recommend a repeat screening with new partners. That is hard, on the other hand, when you're not getting that back from the other person.
Right.
But I think that's great that you stand your ground on that. The other thing that I kind of want to add, I definitely want to emphasize the importance of getting screened. but also destigmatizing when people do test positive. Because I think that is one of the reasons why maybe people don't get screened. They're worried about, wow, what if I do have something? Is that embarrassing? So I just want to normalize that, if you're sexually active and you get screened and you test positive for something, the most common thing I see is chlamydia. This is something that is treatable. You identify it, you can move on with your life. There should be no judgment. Unfortunately, I think as a society, we still have that a lot. And I do know people get that from healthcare providers a lot. So hopefully if you're someone that is dating and sexually active and wanting to be screened, find someone that is not giving you judgment when you come in for that.
True. Now, you said the most common one's chlamydia. How do you treat that?
Yeah, it's a course of antibiotics. Again, not saying that it's no big deal. Of course, this is an infection and it can have other potential complications. But like early identification and treatment, most people are able to get that taken care of and they do not have any issues moving forward.
Cool. Okay. Are there any other pretty common STIs?
The other thing that I would say that I see most commonly and that can be pretty distressing for folks is the diagnosis of herpes. And again, I think that's because it has a really big stigma associated with it. Now, herpes, it is something that you can't get rid of. You'll always have the virus in your body. You may continue to have outbreaks the rest of your life. So that part of it is really difficult. But again, it's really common, so I always emphasize that to people when I am diagnosing them. And the symptoms, the outbreaks can be controlled with medicine.
Okay, cool. So I guess if you were to give best practices on dealing with that, since it is such a stigmatized thing, what would you say?
Yeah, so if you are diagnosed with herpes or any STI, of course, you want to make sure you're not transmitting that to other people. So chlamydia, obviously you would want to inform any partners, we usually say within the past 2 months, and they should be tested and treated. Now, herpes can be a little bit more complex. In general, we don't recommend testing for that unless there is symptoms. So like sores, like painful sores on the genitals is normally what you're going to see with that.
Okay.
But to think about avoiding infecting other people, definitely condom use and definitely avoiding any sort of sexual contact if you have an outbreak or feel like you're getting an outbreak.
Okay.
A lot of people ask me, okay, I had a history of herpes. Maybe I haven't had an outbreak in years, which happens all the time. Sometimes you only ever get one outbreak in your life. Do I need to tell a prospective partner? That's a tough question. I don't think that there is like a straight answer on that. If we're thinking of overall the best, like honest, most ethical thing to do, probably, because there's always that risk that there's that potential that you could transmit it to them. But if following safe sex practices depends on kind of what sort of relationship you have with them, it's ultimately going to be up to you.
Interesting. So if there was like a very short and sweet general guideline that you'd give for safe sex practices and screening, what's the Cliff Notes version?
Yeah, get screened early and often. Use condoms. I know people have lots of opinions on them. I think if you can make that part of your sex life, like a habit, it makes it a lot easier.
This is maybe a weird question. I don't know if you have the answer. As far as condoms go, do you hear from people like what the best ones are as far as like still enjoying yourself?
Yeah, so I actually pulled up my old dating blog.
Oh yeah, tell them what it's called.
Okay, so the reason that Blair and I even linked up is that I had a dating blog. It was called Ghosting and Gynecology. And blogs used to be cool. People weren't podcasting that much then. it was kind of at the end of blogging, though, to be honest. But I actually did have a little bit of a post about some safe sex things. And I wrote, based on my professional and personal experience, that I thought that Trojan really did have the best condoms and that Lifestyles were bad. So...
The Lifestyles were, that's a brand?
Mm-hmm. Yeah, it's one of the cheaper brands.
Okay.
Now, that being said, they're all effective at preventing pregnancy and reducing STI transmission. You know, you can get them free of a lot of places. So all condoms are good condoms. That's just what I had written based on my personal research. And I also had on there too, you know, you go to like CVS, a lot of times they're in that lockbox. You have to have someone open for you.
Mm-hmm.
No, we can order these things online now, get them delivered to your house privately, and then you're set.
I love that. And oh man, I had a thought and I'm trying to get back to it. Something to do with condoms. I don't know. I'll let you know if I think of it.
You can always circle back.
Yeah, for real. Is it a myth or true? Can you get STIs while using condoms?
You can. So it kind of depends on like which STI we're talking about.
Okay.
So that's why I said reduces your STI risk. So say, for example, herpes, that is spread from typically like a sore or a lesion. If the so skin to skin contact. Yeah. So the condom may not cover that.
Okay.
Infection could still potentially spread.
Okay.
Or of course, you know, condoms sometimes can break or fall off or are applied incorrectly. But overall, they really do reduce the risk.
That makes sense. Other than herpes, what are like the most common ones that are transmitted while wearing them?
That would be the main one, because a lot of other ones are from like body fluids.
Okay.
So usually our condoms are reducing that.
Interesting.
But again, they're not foolproof.
Okay. Cool. All right. So any other things to add to this topic of STI screening, treatment, safe sex, etc. before we move on? So a newer area that I am just actually starting to kind of learn more about. We hear about, PrEP, pre-exposure prophylaxis. So for people who are at increased risk of HIV, this is something that has been identified to be underutilized. It's basically medication that you can take that reduces your risk of getting HIV. So do you take it if someone else has it that you're dating, or that would be someone who would be a candidate for it? Okay. There are certain guidelines that I don't know off the top of my head on like who should consider it. Okay. But I was recently reading like, more people should probably be on this. Interesting. Mm-hmm. Huh. Wow. So possibly something to think about for people, depending on like what your sexual practices are, who your sexual partners are. Okay. Yeah. Random question I had about this. So I know you can swab your hoo-hoo. Mm-hmm. You can pee in a cup. Yep. And you can draw blood to test for STIs. Yes. When you're doing your consistent screening, what should you be doing? All of it every time? So you can do different sources for different infections. So for our blood work, that's usually what we're looking for: HIV or syphilis. You can also do hepatitis screening. And do those ones normally have symptoms? Not necessarily, no. Okay. Mm-hmm. And then if we are wanting to look for gonorrhea, chlamydia, trichomonas, that's usually going to be our urine-based or swab-based. Mm-hmm. Swabs overall are a little bit more sensitive. Self-collected swabs are absolutely acceptable. Mm-hmm. But a lot of places will offer either one kind of based on patient comfort or like test availability. Mm-hmm. So I would say you typically would not need a urine and a swab. Because they test for the same things usually? They do at my office. Now that being said, all labs and tests are like validated for different things. So it's possible. Okay. Maybe some places, we can only test for trichomonas on this, or we can only test for chlamydia on this. Might just be what they have available. Okay, interesting, cool. All right, you ready to move on to something else? Let's do it. Okay, so you mentioned before that when you have people come in, sometimes it's more of like a life thing rather than a medical situation. So, and you also mentioned previously about dating insecurities and then dating burnout. Can you touch on that?
Absolutely. So I think probably the two biggest things that I hear about from my patients, if they are not married or not in a long-term relationship, if they're still dating, is the dating, especially app burnout. And
oh my gosh, yeah.
Yeah, it's a thing. I experienced that too, so I totally relate with that. And then I think on the other side of that is fertility concerns.
Okay.
You know, as women, we do know our fertility declines with age, and for people who want kids, that can create a lot of anxiety. You know, am I going to run out of time before I meet the person that I want to have babies with?
Okay, so to get a little personal for a second, so back on the market, in case anyone cares to know, and I'm 31, which, by the way, can I ask how old you are?
I am 36.
36, okay, cool. So at what point should I be concerned, like at what age should women generally be concerned about their fertility?
Yeah, so we do know roughly around 35 is when we start to see a decline in our fertility. It's not a cliff. It's a slow decline. And then, you know, each year it does kind of continue to decline. But that being said, of course, we all probably know people who have had babies in their 40s, right? It can everybody's different. Some people, it's at a quicker rate. Some people, it's at a slower rate. And it's not always like lifestyle based. A lot of people think, oh, I'm healthy, no problem. Well, unfortunately, fertility doesn't work that way. So I say as you're getting closer to 35, if you just to really think about your goals. And it can be helpful to meet with a reproductive endocrinology and fertility specialist physician if you are interested in having, you know, testing done. Egg freezing, of course, is a thing. It's a big undertaking. It's expensive.
At what age would you worry about that? 35?
I would at least be just clarifying goals at that point and kind of looking at where you are and thinking about, you know, kind of like how you want to plan things. So some people will decide, oh, okay, if I don't partner ever, I don't want to have kids. Okay, fine. Or
I'm that way.
Yeah.
I don't want to do it alone.
Yeah.
No, thank you.
So that's the answer there. Some people might decide, maybe I'll freeze eggs. That way, even if I meet someone in 5+ years, I might have the option. Some people might decide, oh, well, yeah, maybe I'll still meet someone and we'll try or do infertility treatments at a later age. Some people will choose to like go ahead and get pregnant on their own. So I see people do all of these things.
How often do you see people getting pregnant on their own without a partner?
More often than I used to.
Okay.
Yeah. So, I mean, I take care of, you know, a couple hundred people a year. Usually one or two are single parents by choice.
Wow. That's like so hard to imagine because it's all the bills are on you. How are you going to get a babysitter by yourself? Like, all the things. I don't know. It just seems like a lot.
It is. I definitely respect them a lot, especially as someone who is a mom that has a partner. That's hard. But if this is their life dream to be a mom and they're really motivated and they go for it, I am right there with them.
Wow. I mean, I think it's great. I've heard of it one time before. Usually they're single moms because the dad is a deadbeat.
Yes. And so I think sometimes the expectation of if people know, oh, I'm going to choose to be a single mom, and they probably will set themselves up to have other support, other resources. I mean, that might be easier than someone who is married and lives with someone who doesn't help them at all, right?
Yeah, true. Because I don't want to have kids if that's what.
That might be worse.
Yeah. Well, yeah, because then you have an extra child in adult form.
Yes.
And I'm sorry, but no thank you,
Yeah.
I'm going to pass on that.
So I think that the people who choose to be single moms, that's something that they kind of think about. They're like, no, I know what I'm signing myself up for.
Yeah. And I mean, I'm a single dog mom right now, so.
You know, you got to take him on, him or her?
Him.
You got to take him on all his walks.
Yeah.
Yeah.
It's
all on you.
It's a lot.
Mm-hmm.
So, anyway, well, cool. Anything to add to that before?
I would say that it kind of would link back to the STIs, that like when you are dating, that is something that causes people anxiety, or
Yeah.
or of course like birth control failures, pregnancy scares. That's stressful.
Do you have any suggestions on how to approach, like I date men, so how to approach men regarding getting tested? Because like part of me, if I'm going on the apps, do I put on there, I require a clean STD test or STI test to be with you, FYI? Do I forewarn them? Like, that seems wrong in my head, because that's going to deter people immediately.
When do you have this discussion? Yeah, that's a great question. So we got to make it easy for them, right? So like, do we know? I don't know. Where's like an easy, accessible place for a man to go get tested?
There are free places.
Yes.
I don't remember the name right now, but I have it on my phone.
Yeah. So, like, I think having some like specific suggestions could be helpful, and you know, kind of start off by, well, this is something that's important to me. I just want to let you know that I got tested. These are my results, and it would make me comfortable if you would go ahead and get tested too.
Mm-hmm. Yeah, and then let's role play for a second.
Okay.
I'm the guy in this situation.
Okay.
I mean, it's not that big a deal. I haven't been with someone in like 3 years. How do you respond?
Yeah, I actually was recently reading that STIs are really underdiagnosed, and they're probably more common than people think, and that most people don't have symptoms. So I've decided that I'm actually not going to sleep with anyone unless they get tested first, just so I can feel confident going into it.
Okay, well, I mean, I guess bye. I don't know if that would actually happen, but...
Okay, I just remembered that on one of the apps back in the day, I remember someone had their results like on one of their photos. I thought that was a little bit much.
Wow.
But at least they were taking it seriously. I don't know.
Yeah.
And I mean, maybe I'm assuming they were on there probably just for sex. So if they wanted to lead with that.
Which app was it? Tinder?
Probably. I've tried all of them. So, yeah.
So you're married now.
I am married. I'm a mom of soon to be 2 children.
Cool.
Yeah.
And how did you meet your husband?
We met on the apps. So we met on Hinge. It's hard to remember because, yeah, like certain ones were more popular at different times.
Yeah.
But yeah, prior to meeting him, I dated quite a bit. So yeah, so dating is still something that's really interesting to me and something I still really like talking about.
Yeah, well, thank you for talking about it.
Yeah, and just relationships in general.
Yeah, honestly, me too.
Yeah.
That's why this started, because I basically was like, what's a topic that I enjoy talking about that I feel like I could talk about forever, and here we are.
Yes, and I love that you are coming at it from with your comedy background. I also love comedy. I love female comedians.
Do you have any favorites?
I mean, all of your main popular gals that like have all the Netflix specials. You know, I've seen Chelsea Handler multiple times. I mean, who doesn't love her? She's one of the greats.
Yep, and I think she's coming to town like really soon.
Yes. And I'll just say, if someone says they don't like comedy, that is a red flag.
Yes.
I would ghost. I think that's ghostable.
Have you ghosted before?
I have definitely ghosted before, and I have been ghosted.
Okay, can you tell me about that?
So, and I mean, ghosting is a spectrum, right?
Mm-hmm.
I think
Okay, wait, stop. Ghosting is a spectrum. All right, let's hear the spectrum.
Okay, so I don't really consider, if you've been talking with someone on an app and you've never met and you quit talking to them, I don't really think that's ghosting.
Yeah.
You weren't truly in their lives.
Yeah.
That's fine. That's an annoying part of the dating apps.
It is.
That contributes to dating app burnout.
Yeah.
Absolutely.
Yeah.
But I think that's okay. Now, when I was dating, I kind of had the mindset that if I went out with someone once, that it was acceptable to ghost. Now that I'm a little older, a little more mature, okay, that's probably not the best practice. It's probably better to just be straight with people.
Yeah.
And tell them if you're not interested. But that's kind of what I was doing. And I did have a lot of scenarios where like it was almost like both parties kind of just quit talking.
Okay.
But I think a true ghosting is when you've been out with someone more than one time, and they try and contact you, and they're never able to reach you again. Like that's a true ghosting, in my opinion.
And when that happens, is it like delete, block, etc.?
Probably just ignore.
Okay.
Yeah.
All right. Interesting. So, okay, you've definitely ghosted. Now, like, obviously the name is Ghosted and Roasted. Do you have anyone you want to roast? I mean, I know comedy's not your forte, per se, but you like comedy. Or anyone that you kind of want to just be like, man, this guy sucked. Here's why.
I mean, I have what I would say a very diverse dating background. I have dated people who were really successful.
Uh-huh.
I dated someone for 2 years that didn't have a job, like kind of like by choice.
Trust fund baby or what?
Unclear.
You dated him for 2 years and you don't know?
Unclear. Yeah.
What?
So I wouldn't say there's anyone in particularly that I would want to roast, and I am not a perfect person either. I'm sure many of the people that I went out with would have some things to say about me.
Oh, I mean, same. Just that I'm really cute and really nice. So. Honestly, okay. How do you feel about getting dumped via text?
I think it's okay if you haven't been out that many times or if you haven't been together that long. So maybe couple dates, someone decides they're not feeling it. I think that's acceptable. That's normal.
How about if you dated for 3 months?
The 3-monthers are tough. I think it's probably okay.
Why?
I think it's okay because it actually might protect that person a little bit.
From what?
That's vulnerable, right? You're like possibly hurting their feelings, letting them down. Maybe it's a little bit more private.
In my head, it's like,
it's rude.
You're an adult.
It's true.
Grow up.
I think that's true. 3-monthers are tough because I feel like if you like that person, it's just long enough that you're like starting to maybe think that it could be something. And so even though like that's not really that long of a time.
It's a quarter of a year though.
Yes.
Yeah.
You might have like in your head mentally progress things like, oh, well, if this continues, like this could be something.
Uh-huh. Interesting.
I had a lot of 3-monthers.
Really?
Oh, yeah.
And did you dump them via text? Did they dump you via text?
I kind of feel like yes.
Really?
I feel like I feel like either it would be text or in person.
At what point is breakup etiquette like you're a dick if you do it via text? In your opinion?
I think it also depends on, I had some people that maybe I was seeing for a couple of months, but like not that frequently, it wasn't that serious. Mm-hmm. Versus if you start seeing someone like a couple times a week, at 3 months, you could be like, or like, have you gone on vacation? Have you met their family?
Let's back up.
Okay.
To my most recent dating experience.
Let's talk about it.
I'm not going to get too into the nitty gritty, but dated this guy for just over 3 months.
Okay.
He defined the relationship.
Okay.
And then he also, last week, texted me to break up with me.
Out of nowhere.
Yeah.
You didn't have any feeling that, like...
I could tell that things were... Like, I had, like, said, hey, I feel like this isn't really progressing.
Mm-hmm.
And so I brought it up, and I was like, we hadn't even... We had been dating consistently for 3 months, but we hadn't even, like, stayed the night with each other.
Okay.
And I even was like, let's do this.
Yes.
You know?
I would have been thinking the same.
And I'm like, I don't want to waste my time. So to me, I was like, what the hell, dude? Like, that's pretty shitty. And he's older than me. Like, you definitely are old enough to be mature enough to do it in a more classy way. At least give me a call. Like, and I'm sorry, you can't wait until, like, he had to do it immediately. So I woke up to it in the 7 o'clock hour. Woke up to getting dumped.
7 a.m. is too early for a breakup. I definitely affirm that. But do you feel like you would have felt better if it was in person or on the phone?
I would have felt better if it was on the phone. I feel like, in my opinion, texting to break up with someone that you've dated for more than a couple of dates is kind of rude. It's really rude.
Yeah. Okay.
Like, that's just me, but apparently you have a different experience.
Well, this has also been a while, so I might just be forgetting all of this, too. So.
Well, I don't know. And, yeah, I think it's for the best, though. Like, I think it took me some processing, like, thinking about everything and our personality types being different. And, honestly, if I have kids with someone, I feel like he's pretty absent, and I don't want that.
Yeah, that's a no-go. And even if you already were kind of thinking that things might not be a match, it's still kind of a letdown.
Well, yeah, it is. And for me, like, I knew, like, I feel like internally, I'm a natural people pleaser, so I was denying myself, like, I wasn't being as honest with myself as I should have been about the reality of the situation. And, like, I had hope for it and stuff, because I'm so tired of dating apps and so tired of the dating scene, because it's just exhausting.
Here we go again.
This burnout.
Mm-hmm.
Yeah. But I think in my heart of hearts, I could see it wasn't going somewhere. Like, this gal, okay, I have to laugh for a second. My friend Gabriella makes fun of me to no end for using the word gal. You used it earlier, and I loved it. So I'm like, okay, Gabriella, suck it. But anyway, this gal that I met at a happy hour, she was like, oh yeah, I have some Italian sons that I'd like you to meet. And in my head, I wasn't getting what I needed in the relationship, so I was like, that'd be nice. But I told her, well, I'm dating someone, so, I can't. That's off the table right now. But I guess it's back on the table, so Italian boys, hit me up.
Sounds like something you might be interested in.
Yeah, who knows? I'm open to it. I feel like whatever I do dating-wise, I want to take things slow. But, yeah.
Well, I would say that my advice for you or for anyone that's dating is when you do have those thoughts deep down, where this is probably not going to work out, this is probably not my person, or like I have concerns, those little, like when you lay down at night and you're trying to go to bed and you have that unsettled feeling and try not to ignore that.
Yeah.
Because I definitely used to do that, and I would want to see like the good parts of people.
Right.
That's instinct, right?
Right.
You want it to work out. You don't want to have to go back on the apps.
Yeah.
You want them to be your person. But if they aren't, it's not, you're not going to be able to get past that, and you don't want to waste your own time.
I mean, that's so true. And it's just like, I gotta train my brain to like notice those things like immediately, and then just break up text people, apparently.
Hey, maybe it would make it easier.
Yeah, I don't know. We'll see. Dating it's an art, not a science. There's like nothing, there's no procedures that are exactly perfect for it. It's just it's complicated because humans are involved.
Yes, I think that is also a really good piece of advice for people, is that we're dealing with human emotion.
Yeah.
There's no one right way to do it. What worked with someone else that you dated might not with someone else.
Yeah.
Married people like me try and say things like, when you know, you know. Well, until that happens to you, you actually don't know. So.
For real. And so did the you know thing happen to you?
Unfortunately, I'm one of those annoying people that does actually believe that now. It actually was that easy for me when I met my husband.
So tell me, so you met him from a Hinge date. Where'd you go?
Okay, so this was 2020.
Yeah.
This is pandemic times. We matched on Hinge. We actually did a video chat through Hinge.
Oh,
and that was
okay.
my first time ever doing it. I was a little bit hesitant. Not sure why, but we did immediately. Convo is flowing. Thought he was cute. So I invited him over to my house the next day.
What?
Everyone be safe out there. I'm not saying that you should do this. I kind of looked him up online and such. But we ended up video chatting for like 2 hours.
Wow.
So I ended up inviting him over to my house, and basically we've been together ever since. He came over the next day and spent the night at my house, and then like maybe 4 to 6 weeks later, we were living together.
What?
And then he bought a house for us like 2 months later, and then I moved in with him there.
When did you get married?
So we met 2020, moved in together and engaged in 2021, married 2022.
Did you meet pre or post pandemic?
Very mid. Yeah,
Very mid, okay.
It was probably, so it was like October of 2020. And we had lots of waves then, and it was during a wave where you couldn't do much. And I actually think that like accelerated our relationship. So say like the holidays that year, we both work in healthcare. We were worried about exposing our families, so we didn't do much with our families for the holidays. So we spent holidays together, even though we've been dating for a brief time.
Wow.
So, or just, there wasn't a lot else to do. So we just hung out, and I think that kind of sped things up for us.
Yeah. Wow. And since you both work in the healthcare industry, I guess you probably had stuff in common.
Yes, that is something that I really do like about our relationship. So he's a dentist, so, completely different role, but we're both healthcare providers, and, understand what that can feel like on a day-to-day basis.
Wow. So at what point did you guys define the relationship? And you were exclusive and...
Yeah, I think a couple days after meeting, because I wasn't talking to anybody else at that time, and he straight up told me that he had been just talking to someone else on the apps, but I don't think they had even met yet. Mm-hmm. And he told me like, oh, hey, just wanted to let you know I was talking to someone else, but I told her that I met someone, and I'm deleting Hinge. And I was like, oh, okay, that sounds good. I'm going to delete Hinge.
Wow. I can't believe how fast that went.
Yes, and that was obviously scary, because although I was happy, things were going well, when you've dated a ton, you're like, well, like, when's this all going to fall apart, right? Like, is this guy too good to be true?
Yeah.
But eventually, we kind of just settled in, and it became a stable thing, and I realized that it was for real.
Wow. Interesting. So at what point do you recommend, or not recommend, at what point do you feel like it makes sense for people to define the relationship, since you talked about when you defined yours? Yeah,
I think that whenever you are feeling like, I want to be exclusive with this person, I'm no longer interested in pursuing anything else, that's your opportunity to have that conversation.
That makes sense.
Yeah, and I think probably sooner than you might think, and don't be afraid if they're not on the same page as you, although that's going to be upsetting, better that you find out sooner, right?
Do you think that you should define the relationship before you get intimate, like sex?
I think it's up to you as a person.
Okay.
Yeah, I think.
but you personally, what's your opinion?
I don't think you need to. I, as someone who was dating, was open to although I was looking for a long-term partner, exploring things sexually with people without being monogamous. Again, with safe sex.
Yeah. Okay. Cool. All right, let's see. I know you have to wrap up here soon, and I do too, actually. So, do you have any other random thoughts before we get to the last question, which is about dating advice?
Let's go into dating advice.
Okay, what dating advice do you have for people other than what we've already said?
Yeah, so be open and curious.
Mm-hmm.
We're all on our phones and headphones, but if you can be open to your environment, maybe there's someone to meet in the wild. Apps are great too. I still believe in the apps because I ask people all the time how they meet their partner. That's still over 50% of people are meeting them on there, I'm pretty sure.
Okay.
And like I said before, listen to your inner voice on someone that you're dating. And if you are anxious or uncomfortable about them, it's not a good sign.
Yeah.
And it's probably best just to move on sooner than later.
Yep.
And yeah, I think defining the relationship sooner than later, if you want to, if you're ready to do that, also is serving you.
Cool. Okay. Also, you see a lot of lady parts in here. What are the grooming trends of today?
You know what? People's grooming trends are just as diverse as them. And to start with, you do not have to do any grooming to come to my office. If you have never shaved or trimmed a thing in your entire life, that is fine. That is absolutely normal. Some people do not. There is no medical reason why you have to.
Are there any medical reasons why you shouldn't?
Well, some people, depending on what kind of hair removal practice, it can cause, irritation, bumps.
Yeah.
So, I still see a lot of people doing waxes. I personally find those incredibly painful.
Yeah.
But if you don't mind doing it and it's not causing you any skin issues, fine. I think overall in the medical community, our best recommendation is probably trimming is safest in terms of not causing irritation or infections. Like a little buzzer.
Oh, okay.
A lot of people like laser hair removal. Expensive, definitely can cause some pain, but if you're wanting long-term hair reduction removal, that works too. But yeah, Everyone's different. Some people have patterns down there. Some people have piercings down there. You don't have to give me a heads up or anything like that. Whatever you have going on is probably normal and something I've seen before.
Wow, patterns. I'm so curious about that. Okay.
Tattoos.
Ooh, on what part?
Some people might have an arrow pointing.
On the front?
Yep.
Okay. Wow. I never have heard that until today.
You just never know.
Okay. Cool.
And yeah, it's all normal. It's all welcome.
I have one more question because we're getting to the end, but I meant to ask this earlier. Do you find different stages of your dating or relationship status define the kind of panties ladies wear?
I think so.
Yeah?
I think in general when people are dating, they're going for something a little bit sexier. As people in long-term relationships, full-term pregnant here, we're going for comfort.
Yeah.
Not everyone. Everyone's different. But that's been my personal experience, and I feel like that's the experience of my close friends too.
Yeah, I feel like my personal experience, just asking men's opinion, while dating them, most of them don't even care what kind you wear.
This is absolutely true.
Yeah, so I go for cute and comfy at the same time.
Yes, I think I don't think it really matters. I think you should just wear whatever you want, and they're probably not going to be seeing them for a super long time anyway. Also, if you're dating a guy and he was specific about your underwear, it's kind of icky.
Yeah, it seems like a control.
Don't tell me what to do.
Yeah, control problems. And yeah, he can fly a freaking kite. Yeah, okay. Well, any last things before we wrap up?
Good luck out there. Be safe.
Yeah. Well, may your dates be great and your red flags be obvious. Talk to you next time.